Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health and the Center for Men's and Women's Urology, coming to you from Portland, Oregon. And I want to talk to you today a little bit about a condition called pelvic floor dysfunction. Now, I just want to be upfront and tell you that's a pretty generic term. It means that the muscles of the pelvis are not in proper balance, and some are in spasm and some are weak, and some are preventing you from voiding or having intercourse comfortably. Sometimes you have spasm in the pelvis and in the pelvic muscles that also prevent you from exercising or moving properly. And I want to also tell you that that can come with a constellation of symptoms, meaning you can experience increased frequency of urination, urgency, meaning that you've got to get there right away or you feel like you're going to wet your pants. Sometimes patients will oftentimes come in saying to me, hey, you know, it really takes me a few minutes to start a urine stream. I have to sit there and consciously relax. All very common scenarios. And we do bladder function studies and we find that the pelvic muscles are in spasm. And when we put the camera inside the bladder, we see that the sphincter, which is the muscle that holds urine back in the urethra, which is the tube that carries urine from the bladder to the outside of the body, we find that that area is in spasm, and it's oftentimes uncomfortable to put the camera in because the sphincter itself doesn't want to relax to allow the camera to go inside and take a look. Now, these are all very common conditions, and they can be caused from everything from childbirth to too much exercise, to pelvic trauma or pelvic surgery. Sometimes it just happens because we're all upright beings, so all of our weight rests on our pelvis as we walk around. And even moving in an abnormal way or doing an exercise that may not otherwise be comfortable for us can set off muscle spasms in the pelvis, much like you get back spasms. Now, what can we do to remedy it? Well, we use any number of items here in our office. Our mainstay of therapy is pelvic floor physical therapy, meaning actually seeing a physical therapist that deals specifically with the muscles of the pelvic floor. Now, what that typically entails, much like you do physical therapy for your shoulder or for your back or for your knee, they actually work on the muscles of the pelvic floor and the muscles of your abdomen to help realign and rebalance those muscles so that you can actually void more completely, that you don't necessarily have to hesitate and relax consciously to be able to pee. Sometimes it also affects your bowels in exactly the same way. You feel like you can't evacuate your bowels completely. We will use physical therapy, and sometimes, depending on how much spasm the muscles of the pelvis are in, we will use vaginal Valium suppositories, we can use muscle relaxers, and for those instances where you have a difficult time starting a urine stream, we can use a medication called tamsulosin to help relax the sphincter and help facilitate easier voiding. Now, if you're experiencing any of these things, certainly see your doctor. Tell them what you're experiencing. A lot of times painful intercourse goes along with this, and that pelvic floor physical therapy works wonders. So I hope this helps. If any of you all are experiencing this, get on into your doctor because you don't have to live like this. There's a treatment. So I hope this helps. Keep sending in your questions, and as always, let 360 Pelvic Health help restore your confidence.